You mentioned that this is to help people in primary care. I wonder if I could just press you on that. Who exactly is this document for?
Well, the Differentiating the Cs is clearly aimed at primary care. This is a document for healthcare professionals to use in order to triage their patients. There is a whole other bit of work that needs to be done in messaging to patients, and I'm glad to see that the government now are very much saying that, well, they have been for some time actually, saying the NHS is still open for business, but we need more specificity. We need to make sure that there's a clear message to individual people about individual conditions that they might have, and that means saying to them, if you have a cough, then don't just say stay at home. If you have a cough with these certain features, that is to say more than 3 weeks and is persistent and different from normal, then it could be that you actually have something more serious rather than COVID, which can also be serious. So discuss it with your GP, and then you can make a decision. That's the sort of message that needs to get out there. It needs to be relatively simple, a lot less clumsy than I've just outlined there, of course, but something catchy, just to make sure the patients do seek medical advice. And then from the primary care side of things, they need to make it relatively easy for people who are concerned that they might have cancer, but also concerned they might have COVID, to at least get some telephone advice. And at the moment, that's clearly in many practices not happening. It's difficult to get through to telephone advice, and that has to be rectified, because at the moment we're in a situation where there are an enormous number of people who are probably sitting at home with their cancer, getting worse because it's getting later and later stage. The other real concern that we have, of course, is that many patients will actually never be diagnosed with lung cancer. They will die from pneumonia or perhaps even COVID. We label it as COVID, but actually they had lung cancer. And we know this. The signal is that we would not have that many referrals, not have that many cancer patients coming through our system. And cancer won't suddenly stop presenting. It's always going to be there. But the problem with lung cancer, as I said earlier, is that the median survival is only 6 months. So already 35% of people will have died. And that is absolutely awful. And this is the reason I think this is quite urgent and quite important. So from a primary care perspective, it's about using the guidance to enable them to triage patients more accurately. And for patients, they need to be given a clear message from the national team that it could be something else, not just COVID.
For many people with a cough, the first port of call would be the community pharmacy. And indeed, many community pharmacists are very well aware of the patients with persistent coughs. So what would you say to community pharmacists?
So I've been really impressed with a lot of the research work that is done with pharmacists as a mechanism to get healthcare messages over to patients. And I think in my mind, I regard them as part of the primary care team and the interface between the patients and the healthcare system. And my role as chair of the Screening, Prevention and Diagnosis group of the National Cancer Research Institute, we look at a lot of research projects involving community pharmacists. So I would say to pharmacists, the same I would say to any of the other primary healthcare professionals, that please do read the document if you have access to it, and understand that you have an incredibly important role in guiding patients to the appropriate further action. And this might be to say, this is quite important. I think you should talk to your GP about this, because you may well need to be referred on. Or, this is the sort of thing that we would normally recommend you to just stay at home for a couple of weeks, and then if you've still got the symptoms, and see your GP at that point. So you could actually get the pharmacist to manage the Differentiating the Cs document very, very effectively. So I would love that community pharmacists would also read this document, and in fact any healthcare professional that has an interface with the patients, an opportunity to get this message over, I think will be incredibly helpful to the cause.